Hi, it's the nursing professor here. I want to talk to you today about the 10 concepts you should be familiar with as you're studying for your fundamental final. All right. And so number one is the nursing process. I've said it all throughout the semester. It's so important that you understand how to apply the nursing process. It's going to help you with prioritization when you have questions like that. You should also know how to use Maslow's hierarchy as well as the ABCs, which are airway, breathing, and circulation. Those tools will really help you answer questions. Number two is vital signs. You should know the norm for an adult. You should know which thermometer would be best used to get the most accurate temperature measurement, and that would be a rectal thermometer. You want to know where to place your stethoscope in order to hear breath sounds and cardiac sounds. Number three is infection control. You want to know, of course, washing your hands for 20 seconds. If soap and water is not available and you haven't come in contact with organic matter, which means blood or body fluids, then it's okay to use hand sanitizer. Let that air dry. Don't be blowing and carrying on, recontaminating your hands. Also with infection control, understand the precautions like standard precautions, droplets, contact, airborne, and know what you would do in order to take care of those patients who are on that type of isolation. You want to know about donning and doffing a PPE and the sequential order that you put those things on. Like, you put your gown on first and then what comes next? What comes next? All right, so you think about that. Also, medication administration. I know some schools use like 10 or 12 different rights of medication administration, but we're going to look at 6. 6 is always the standard. And so you want to make sure you have the right patient, the right med, the right route, the right time, the right dose, and of course, the right documentation. Okay, so you need to know those. You need to understand that if a person is administering medications, that you are not going to interrupt them, because that will help minimize medication errors. With the routes of administration, then you want to be aware of all of their injectables, like your intramuscular, your subcutaneous, and your intradermal, and what gauge needles should be used with that, and what are the preferred sites. And what is the angle of administration? So make yourself a chart and know those things, because that becomes very important. Dosage calculations, can't get away from that. Dosage calculations, and also know your measurements, that, 1,000 millimeters equal what? Those kind of things like that, because you should be able to do those conversions. Communication and documentation. If it's not documented, it's not done. Know that therapeutic communication is how you talk with a patient, whereas, regular communication is like, hey girl, how you doing? Okay, know the difference between that. Know the legal aspects of documentation, that you should document as soon as possible so that you're not forgetting anything. So it should be timely and should be accurate. Safety and fall prevention is very important. You're gonna make sure call bells are always within reach, that beds are at their lowest level to the floor, that people have on non-skid socks, that people have on clothes that fit, that the pants are not too long where they're dragging, that if a person has a cane or walker that's close by near them, those types of things. Hygiene and basic care, you want to be aware of that, to know the difference between a partial and a full bath. Know about when you're cleaning dentures, what you should have in the sink. You remember you had to put that washcloth in the sink, because if the dentures failed, then they would not break. Elimination, you want to know about GU-GI elimination. GU, of course, is urinary. GI is, of course, bowels. You want to know how to assess both of those. You want to know how to collect specimens, especially with the Foley catheter. How do you get a sterile specimen? How do you do perinatal care? Those types of things. Oxygenation and respiratory support. You want to know the various oxygen delivery systems. You want to know about pulse oximetry and signs of respiratory distress, dyspnea on exertion, or a person who uses several pillows, that's orthopnea. You want to know those things. And last but not least is mobility and range of motion. We talked about different types of exercises that you could do last week. You can go back and check out that video. But understand safe transfers. Understand that it's easier to push than to pull. Understand ergonomics so that you don't end up hurting yourself. If you're in a no-lift facility, you want to make sure that you always have 2 people in order to do that lift. And if a person uses ambulatory aids like a cane or a walker, make sure they know how to use it. If a person is weak on the left side, where does that cane go? It goes on the opposite side. It does not go on the weak side. A walker should be so many inches ahead of your person, and your person should stand upright, not scooted down like that, pushing like they're pushing a grocery cart. All right, so if you find that helpful, please give me a thumbs up, share it, like it. If you want to know any more about any of these things in details, just drop me a comment down below and I can expand on that in a video for you. But these should be your top 10. Good luck on your exams. Bye for now.